I've been asked under one of my videos in the comments section. One of the viewers asked me to do a video on sleep apnea. So that's what I'm going to do here. Sleep apnea. The most common form is what they call obstructive sleep apnea. I'll explain what that is, but in the meantime, you should know that this affects 3 million people in the United States. 3 million. The biggest problem with obstructive sleep apnea relates to cardiovascular problems in the sense that it's closely associated with the development of hypertension or high blood pressure. I also will discuss in this video a brand new study. It was a rat study, and again, I hesitate to talk about or even write about rat or animal studies because they're not always applicable to human physiology. However, the mechanisms in this animal study are fully applicable to humans and likely do play a role. And the interesting thing about this animal study is it neatly explains why some people with obstructive sleep apnea, but not all, get this side effect of hypertension or high blood pressure. There's a reason why some people get it, some people don't, and this study kind of enlightens us and tells us how. I'll get to that in a minute, but let's talk about obstructive sleep apnea. It's basically a condition in which breathing stops involuntarily for brief periods of time while you're sleeping. In other words, you just stop sleeping. You stop breathing while you're sleeping. You don't often wake up, but one of the common symptoms of this is really heavy snoring. I'm talking about the kind of snoring that makes the walls shake. Most of those people almost always have sleep apnea. And in a minute, you'll understand why. It has to do with a blockage of the throat. In other words, the throat kind of relaxes and blocks the airway, and the whole thing vibrates, and you get this horrible snore. Normally, air flows smoothly from the mouth and nose into the lungs at all times. Periods when breathing stops are called apnea or apneic episodes. There's several types of apnea, but the most common one, as I said, is the obstructive sleep apnea. In obstructive sleep apnea, the normal flow of air is repeatedly stopped throughout the night, and the airflow stops because the airway space in the area of the throat is too narrow. Snoring is characteristic. As I said, snoring is caused by the airflow squeezing through the narrow airway space. Untreated sleep apnea can cause some serious health problems, including, as I said, the main one is hypertension or high blood pressure, which is a very big risk factor for development of cardiovascular disease, especially strokes. Hypertension or high blood pressure is the number one risk factor for strokes. And of course, strokes are related to heart disease, and also sleep apnea, obstructive sleep apnea is also associated with diabetes, which is on the rise. Sleep apnea causes episodes of decreased oxygen supply to the brain and other parts of the body. The sleep quality is poor. When you have sleep apnea, sometimes it'll disrupt your sleep patterns. So you wake up with a lot of daytime drowsiness. You feel really tired, almost like you didn't have enough sleep. And, you get foggy thinking. These are just some of the symptoms. People with sleep apnea might also have some other symptoms, such as difficult to treat headaches, feeling very grumpy, as most people would feel from lack of sufficient restful sleep. You get forgetfulness, like I said, you get foggy brain type of thing. And of course, there's drowsiness. The risk factor for obstructive sleep apnea increases if you have conditions or features that narrow the upper airway. Risk factors of obstructive sleep apnea include men with a collar size of 17 inches or more, and women with a collar size of 16 inches or more. That usually this large collar size is caused by more fat in the neck. In other words, sleep apnea is definitely related to obesity or having too much body fat. When you have too much body fat in the neck area, it tends to narrow the airway or the breathing space. This puts you at a very high risk for obstructive sleep apnea. Clearly, one of the most immediate ways to deal with obstructive sleep apnea is to lose body fat, lose weight, exercise, and diet. Other risk factors for obstructive sleep apnea are having a large tongue, which could block the airway. Now, don't laugh, but having a large tongue is a possible side effect of overusing human growth hormone. A lot of athletes use that. And past a certain point, you will not get taller from growth hormone because the ends of your bones have sealed. So what happens is certain organs of the body or certain structures of the body can still grow when you use growth hormone. And one of them is the tongue. It's called macroglossia. If you ever heard Andre the Giant, the late great professional wrestler, listen to the way he talked. In other words, he had this. I'm not making fun of him, but he had this gigantic tongue, and that's why he talked in that particular manner. It's called macroglossia, and it's a very big risk factor for obstructive sleep apnea. I suspect that Andre the Giant probably had that, and that probably played a role in his death at age only 48 years old. Another risk factor is called retrognathia, which is when your lower jaw is shorter than your upper jaw. It's a facial structural abnormality some people have. Having a narrow palate or airway that collapses more easily is another risk factor. As I said, weight loss gives excellent relief from obstructive sleep apnea. It's the very first thing you should do if you suspect that you have it, judging by the symptoms I spoke about earlier. You want to go on a diet, whatever diet works for you. The best diet is the diet that induces the most compliance on your part. In other words, simply put, the best diet is the diet that you can stick with. Don't use a diet where you're going to get severely hungry and go off on a binge or stop dieting after 8-9 days. Use a diet that you can stick with. As you lose weight, the obstructive sleep apnea will start to disappear. Now, if you have to have it treated, the most common way is what they call continuous positive airway pressure, or CPAP. That's basically involves wearing a face mask. The face mask gently delivers a positive airflow to keep the airways open. The positive airflow props the airways open, and it's a highly effective treatment for sleep apnea. They can also give you a dental device that might be necessary to keep the lower jaw positioned forward if you use a CPAP machine. Another treatment is called bilevel positive airway pressure, or BiPAP. BiPAP is sometimes used in the treatment of obstructive sleep apnea if the CPAP therapy is not effective. BiPAP machines have settings high and low that respond to your breathing. This means the pressure changes during inhaling versus exhaling. Another treatment is called positional therapy. Since sleeping on the back or the supine position can make sleep apnea worse for some people, positional therapy is used to help those with sleep apnea learn to sleep in other positions, like on your side, or whatever, on the stomach, or that type of thing. On the stomach is not very healthy. You want to always try and sleep on your side, by the way. That's the healthiest sleep position. Positional therapy and the use of CPAP, you could talk about that with a doctor. If you have to have surgery, they have something called uvulopalatopharyngeoplasty. Don't ask me to pronounce that again. It involves removal of extra tissues from the back of the throat. UPP, which is an acronym, is the most common type of surgery for obstructive sleep apnea, and it helps relieve snoring. It hasn't been unfortunately proven to totally relieve obstructive sleep apnea, and it can have complications, as can any surgery. I would say that surgical means are really extreme way of dealing with this, and should only be used in extreme cases. Like they have a tracheostomy, which can be it's another procedure of last resort. That involves puncturing a opening in the windpipe that bypasses the obstruction of the throat. And you might see this in some of the movies when a person can't breathe. They'll stick a pencil in his throat to help him breathe. It's basically the same thing. Again, pretty extreme measure. I would say to avoid that. But that's basically the treatment. Now, here's what I wanted to talk about here in this video, is I wanted to talk about this new study, which basically it was published in the journal Hypertension. Like I say, it involves rats, but what they found is that eating the typical Western high refined sugar, especially high fat diet, tends to cause a change in the population of the intestinal microbiome. That's the population of bacteria and other organisms that reside in your colon. And when that happens, you get a buildup of so-called kind of toxic bacteria versus good bacteria. But even worse, there's a lower production of what they call short-chain fatty acids. What does this have to do with obstructive sleep apnea? Well, when you have a short-chain fatty acids are very important in preventing systemic inflammation. And it turns out systemic inflammation does play a role in the onset of obstructive sleep apnea, because having systemic inflammation also causes a neuroinflammation, and the body reacts to this by increasing the flow of sympathetic hormones like epinephrine, norepinephrine, which are also increased by obstructive sleep apnea because of the breathing, because of the pressure changes in the thorax or chest area. It causes a automatic promotion of sympathetic hormones, which also cause hypertension. But this explains why a lot of people who have obstructive sleep apnea don't always have hypertension. The ones that do likely have this dysbiosis, or a imbalance of intestinal bacteria, which causes a deficiency of short-chain fatty acids, which induces a systemic inflammation, which adds to the effect. Now, how do you prevent this? Well, the first thing you want to do is consume, as I said in past videos, a high fiber diet. Fiber, the most important aspect of fiber is not only to help prevent constipation, but also fiber, because of its indigestible aspects, is the main food for the intestinal bacteria. You can't break it down in the gut, but the bacteria can. And when they break it down, guess what? They produce short-chain fatty acids, such as butyrate, propionate, and acetate. Those are the three short chain. Short chain just means they have a shorter number of carbons, like only 5 or 6 carbons, compared to medium chain and long chain and so on and so forth. I'm not going to get into fatty acids here, but the point that you want to know is that, if you have obstructive sleep apnea, you always want to ensure that you have a higher fiber diet, and it would be a good idea to take probiotic supplements. So these are supplements containing various strains of good bacteria. Usually, you want to get one that they're measured by what they call colony forming units, or CFUs. When you buy one of these probiotic supplements, you want to get one that has at least 10 million strains of bacteria. The more, the better. A good one would be between 10 and 25 million. By ingesting this, you're going to increase the production of this. And by ingesting these and increasing your dietary fiber intake, you want to aim for at least 30 grams a day of dietary fiber. Not hard to do if you eat sufficient vegetables and fruits. And if you have to, you can do what I do, which is take a separate fiber supplements. I don't get that much fiber from my food. I'm not a big eater of fruits and vegetables. So I supplement my diet with actually 3 different kinds of fiber supplement. One of them is psyllium powder, which is very inexpensive. And I also use what they call apple pectin powder. And the other one I use is a guar gum, which is derived from beans. I mix them all in water and drink them down with a lot of water. You have to drink a lot of water when you use these fiber supplements. And that drink alone gives me over 30 grams of fiber. I get my entire day's fiber in that one drink. So I'm probably getting, I suspect, with the fiber supplements and my dietary intake of fiber, I suspect I'm getting probably about 50 grams of fiber, 40 to 50 grams of fiber a day. I know I'm getting enough. You can tell by how many times a day you have to go to the bathroom. So I know I'm getting enough. Let me put it that way. So that's what I wanted to basically talk about, this obstructive sleep apnea, and also discuss this new study, which very interestingly finds that the people that have obstructive sleep apnea and do have hypertension, it's usually caused by a dysbiosis, or an imbalance of intestinal bacteria due to eating too much dietary fat. The dietary fat causes the intestinal bacteria to break down, not produce enough short-chain fatty acids. You get a systemic inflammation, you get a neuroinflammation in the brain. The end result is hypertension, high blood pressure, whereas other people who have obstructive sleep apnea, for the reasons I described earlier in this video, they might not get hypertension. They'll have all the other bad, effects of sleep apnea, such as drowsiness and foggy thinking and grogginess, but they won't necessarily have hypertension because they're not eating too much fat, and they're not having a dysbiosis of the intestinal microbiome, so they're not getting hypertension. So that's about it. And for those of you that do have this, I suspect I've had it myself in the past. I don't know if I have it. I might even have it now. I don't know, but because I do tend to sleep on my back a lot. But who knows? I don't really have a lot of grogginess, and I don't really get brain fog too often. So I don't have a lot of the symptoms, but it's very common. Like I said, 3 million people have it. That's about it for obstructive sleep apnea. If you want more information on nutrition, supplements, the truth about supplements, ergogenic aids, fat loss techniques that really work, anti-aging research that you can use today. Uh, did I say exercise science? Also, supplements, women's health. All of this is included in my Applied Metabolics newsletter, www.appliedmetabolics.com. 40 to 50 pages every month, no advertisements, pure information. No better source of information on these subjects anywhere on the entire internet. I guarantee it, because it incorporates my 57 years of both study and empirical experience. And so that you won't find you won't find a more in-depth information anywhere on the internet. Those who subscribe, I will send an invitation to join my private Facebook page for Applied Metabolics, where I post information every day on science relating to nutrition, exercise science, and general health. I also have an email portal on my Applied Metabolics website, where subscribers can send me brief questions, and I will answer them at no charge. Only if you're a subscriber. I don't answer unsolicited questions. You're welcome to leave comments underneath this video. I may or may not answer the comments. Most cases, I don't answer the comments. I prefer to answer comments or questions only from my subscribers. And that's about it. So have a good day. Hope you got some benefit from this video. Go to your local shelter, adopt a dog. They're the best friends you'll ever have. And by the way, dogs are known to lower stress, and when you lower stress, you lower the outflow of sympathetic hormones, which means lower blood pressure. So dogs alone can lower your blood pressure. I mean it. Take care.